I wanted to explain a little bit more about frozen embryo transfers. Our practice has moved exclusively to performing frozen embryo transfers. The reason for this is pregnancy rates have shown to be higher. In addition to this, there are less complications for both the mother and the pregnancy. When we're stimulating your ovaries to obtain the eggs, we obtain very high estrogen levels. This is not typically physiologic. This is much higher than your body normally has. When we do frozen embryo transfer cycles, the estrogen and progesterone levels are closer to what occurs in a normal cycle. In a frozen embryo transfer cycle, we will place you on medications to build up your lining. The medications are oral estrogen, and sometimes we use injections to prevent you from ovulating. We do serial ultrasounds, and hopefully we build up the lining to look similar to this. Once we have a nice thick lining, we will then decide on the date of the frozen embryo transfer. Once we have the date on the frozen embryo transfer, we will then begin IM progesterone, intramuscular injections of progesterone. The embryo will be placed in the uterus by a catheter. A transabdominal ultrasound will be performed at the same time to assure the proper placement of the embryo. We will check progesterone levels, and then about a week later, a pregnancy test will be obtained. Hopefully you will be pregnant. If you're not pregnant, the medications will discontinue. However, if you are pregnant, you will continue both the estrogen and the IM progesterone for approximately another 4 weeks until your own body can support the pregnancy.